Hi, this is Joette Calabrese. For those who don't know me and for those who do, welcome and join us. Hi, Gina. Wonderful to see everyone. It's really Sam, Gina, my old friend, Gina Snow. Nice to see you, Gina. Fabulous. So, all right. So tonight we are going to talk about Laurocerasus. Laurocerasus. I'll spell it for you. It's actually Laurocerasus. So it's like a woman's name, Lauro instead of Laura. It's Lauro, and then Cerasus, Cerasus, and it's specific for cardiac conditions. But it's not the only medicine not the only way we use this medicine. We can use this also for respiratory conditions. And so, would you mind closing that door? It's a little.
Click on the video.
Yeah. Okay. Yeah, I'm gonna keep clicking on.
Click on live and then click on video.
Down.
On the left-hand border, just below live, you'll see it says videos.
All right, let's see if it's showing.
Now click on the live again.
Yep. Here we are. There it is, live.
Yep, double click.
Okay, there it is. Now it's finally, now I can see it. Well, they said they weren't going to let me up, and now they are. Or they, I don't know, changed their mind, or somehow I've been able to comply within just about a few minutes. So, I just have to turn off this video. Okay. Yeah, I'm gonna. All right, there we go. So, yes, Laurocerasus. Laurocerasus is the better pronunciation. Please excuse me. Laurocerasus. And it's a great medicine for cardiac. Now, what's interesting about cardiac remedies, and I want you to remember this, it's not true for all of them, but there's a nice little link between cardiac remedies and also respiratory remedies. And we've seen this. We see it in a couple of them. Lachesis, for example, is very important for asthma. It's also very important for the heart. So I want you to remember that there are a couple of them like that. It's something to help you remember that when someone is a little younger, often there's more likely to be asthma. And as the person ages, I'm not going to tell you that it's necessarily going to be the exact same medicine, but sometimes when we see a medicine act for someone early in their lives, and that condition is abated, that sometimes it comes alive again, that need for that medicine comes alive again later in life. There are no rules or laws that I've ever seen. I've never seen Dr. Samuel Hahnemann's aphorism that I can remember saying anything like that, but that is my experience. I've noticed that medicines can be useful for this condition, and then later in life, the same medicine for another condition that the person might develop later in life. And particularly if we can see conditions such as asthma and cardiac. So Laurocerasus, and it is, I'm reading this from my Materia Medica. For those of you who have it, you can follow along with me. For those who don't have it, no worries. You can find this in, and put it right in front of the camera. You can find this online for free if you go to, it'll be a different rendition of the way it's written, but you can find it under Dr. James Tyler Kent's Materia Medica. Or if you happen to have another Materia Medica, you can read up on it. My Materia Medica I've made very simply. I will show you my entry for Laurocerasus. It's not very large, and I did that purposely. I did not want this Materia Medica to be too extensive, because then people get lost in it. And I wanted this to be a very practical Materia Medica so that people can jump right to it and get a good idea. So I'm going to read from my own Materia Medica, and it says the need for Laurocerasus often indicates an overall feeble circulation and weak heart. So feeble circulation, could be when someone is feeling weakened. The heart is weak. They're feeling weak. Or the heart sounds thready with a stethoscope. I urge folks to own a stethoscope. I think it's a great idea to own as many instruments as you can to help yourself so that you can become as self-sufficient as possible. and then go online. I was actually planning on giving you some information on that, but go online and learn how to use a stethoscope. Get a high quality one. I'm talking $200, $300, $400. It's definitely worth it. The cheaper ones are not reliable. And then learn to understand what you're listening to, not only in the heart, but also in the lungs and other parts of the body as well. You can put it also at the carotid, etc. So it's a great little tool. So the remedy is used for bronchitis. Interesting, see? And pneumonia or a spasmodic tickling cough, especially in cardiac patients. See how this all comes together so neatly? So respiratory problems may include cyanosis and dyspnea. Cyanosis is that lack of oxygen and kind of a blueness, and dyspnea means inability to catch air, a lack of be able to breathe. The person may gasp for breath or put a hand to his heart while exercise causes pain around the heart. Exercise causes pain. That is so common. And it doesn't have to be hard exercise. It can be simply going for a walk, depending on the age of the person or on the strength and the ability of the person. So a keynote symptom includes the general sense of coldness and weakness of the mind and body. It doesn't have to be there, but if it's there, that will help you determine this even further. Marked by a lack of reaction to a stimuli. And so lack of reaction to stimuli means if there are smells, they don't really notice it. If you touch them, they don't notice it. It's kind of a feebleness of sorts, not a psychological feebleness, but rather a lack of robustness so that they notice external stimulants. So, and the coldness and chills are not ameliorated by warmth. Fascinating. That's an unusual symptom. If you see that someone is cold and yet you warm them up, you put, heating pads or hot water bottles. Hot water bottles are always better than heating pads, folks, in case you've ever tried to make the decision on what you want to use. Heating pads are electric. We're better off not putting electric against someone who's not feeling so well. But hot water bottles are wonderful. And it's nice to have 2 or 3 of them, because if someone is very chilled, it's great to be able to put the hot water bottles in strategic places, like between the legs, at the chest to hold on to, perhaps in the axillary areas, under the arms, maybe the back of the neck, so that the person can get warmed up. But what's interesting about this medicine is that if you find someone who has some of these symptoms, not all of them, just so you know, it's not all of them. If they have some of these symptoms and one of them happens to be, needn't absolutely be, but happens to be that they are not ameliorated by heat. The cold is not better from heat. And there's a cardiac or respiratory condition, you have got yourself a slam dunk. Is that not beautiful? It's these little observations, these little noteworthy conditions, or we could call them symptoms. We might call them characteristics. We might call them even idiosyncrasies. These are what help you differentiate between this medicine, perhaps, and that medicine. So when you're saying, should I use Laurocerasus or should I not use it? Well, he's got bronchitis and he does have a little heart condition going on here, and the heart's getting a little thready, or there's a little bit of pain on movement, even just going, even if you're helping him go to the bathroom, and that's when the heart starts to be a little painful. And he's cold. I mean, if you could put these all together and stack them, then you've got something really worthy of choosing this Laurocerasus. And what I always say is you want this to stand up in rubrics court. It's a term that one of my old teachers used, and rubrics are those symptoms that we look up in the repertory. In other words, if there was a court of law, you want to say, the judge says, well, why did you choose Laurocerasus? And you say, well, Your Honor, the reason I chose it is because he's got bronchitis, or he's having difficulty breathing, and he's got a little pain in his heart when he gets up, or he's got a thready heart, or he's got a weakened heart. And looky here, Your Honor, he was chilled. And no matter how many hot water bottles I put around him, he could not warm up. Isn't that gorgeous? That's the way you want to look at this. You don't need all of these, but the more you have, the better you can stack your symptoms to fit this picture, the better chance you have of this medicine acting in the way you want it to. Okay, so in fact, the person is likely to sweat in a warm room, and the symptoms are worse when the person sits up and better when lying down. Worse. What does worse mean? It means that could make the heart get worse. The bronchitis might be worse. The breathlessness might be worse. So they're more comfortable lying down. They just don't want to sit up. Please don't make me sit up. I just can't do that. Symptoms are also worse in cold temperatures and from eating cold foods. This remedy is also used for frostbite or true hypothermia. So when someone is made, has hypothermia when they've gotten cold, such as if they fell into Lake Erie in January. So, all righty. Let's see what we've got here. Let's see some of the questions from my mighties, and then we will go to Facebook Live, folks. Yes, I'm glad that you're here too. It's wonderful. Hi, Joette from Wesley Chapel, Florida. Very nice to see. Teresa from Canada. All right. All right, let's see where some of our questions. I'm so thankful for you. I am for you too, Jen. Let me tell you, I say this all the time, but you make it fun. I love teaching you. And when I see that there are thousands of people doing this now, we've got a movement, ladies and gents. We have a movement here. This is really, really taking hold. Homeopathy is generally taught to those who are expected to become homeopaths, professionally. And I said, oh, nay, nay. I want homeopathy taught to mothers and grandmothers. And that's my shtick. That's what I wanted when I was raising my children, what I still want today. And it's very important to me that I get this out to the general public. All righty, let's see what else we've got here. So I teach what other homeopaths won't teach. They don't teach. Some won't, some don't, but none of them do. Let's put it on that way. Okay, I'm on Facebook. Everybody's saying, okay, let's see. Congestive heart failure. How about cardiac damage from relentless hypertension? If it has some of these characteristics, such as a weakened heart, feeble circulation, if there's chills, if any of those symptoms are also happen to be there, then indeed it could be the medicine that we would want to use. And would this be a good medicine for low oxygen levels of the lungs? No, I'm going to tell you the low oxygen of the lungs because we've already covered that. If you go back, you're going to find that one, but I'll tell you quickly because I have the time right now to do this. That's carbovegetabilis, and that's in a 6 or 30. Now, tonight we're going to be using Laurocerasus. I personally would use it in a 30 or 200 and more likely to be a 200. And how often, says Liberty Veritas? I would use it twice daily. And until we saw a nice change. That nice change could come about within a day. It might not come about for some, depending on how chronic this condition is, for many days, weeks, perhaps even over a period of months. But once we see a nice shift, then we start backing off and saying, okay, let's see, the person is doing pretty darn well. Let's back off, see how the person does without it, and look for that tipping point. The easiest online repertory. I've never used an online repertory. I use Robin Murphy's repertory, but I don't know any that are online. Maybe you folks do. Okay, left ventricle bulging, shortness of breath. It wouldn't be my first choice. Can you speak about body dysmorphia. Hold on, it just left me. It goes up and we get so many questions. Eating disorders, depression, especially in teen years. No, we're not going to talk about that tonight, but I have talked about that on my blog, not exactly in those terms. But if you look up depression, you will find information about that on my blog. And then I covered very thoroughly in my course titled Mindful Homeopathy. All righty. Now, I won't talk about it tonight, maybe another time, but really what I would like to do is, what I like to do in these Facebook Lives is stay with the Materia Medica so that we can go through this, and we're only at the L's. I got some time to go through this. And then any current events that seem to be very important. All righty. I miss the potencies, 200 or 30, and I would most often use a 200. All righty, let's see what else we've got. San Antonio, Texas, Wesley Chapel. Okay, now let's get back to these folks. I've got two screens here going on. Valve regurgitation in a teen. No, if I knew of valve regurgitation in a teen, I would want to know that is causing a condition. Not all regurgitation causes a condition. I mean, mitral valve prolapse is a regurgitation. And I consider most, not all, but mitral valve prolapses to be within the range of normal. Make sure that you have checked that, because mitral valve prolapse is super common and not necessarily a disease or a pathology is what I mean to say. Okay, irregular heartbeat. Irregular heartbeat, I would not consider this for an irregular. I would consider it for a weakened heart or a feeble circulation, not irregular. I have talked about irregular heartbeats, and I will be talking more about that. But always start with this, folks. Let me just take a drink of water while I get my thoughts in order, because I want to answer that question. Okay. Whenever someone has a condition, don't make the assumption that the condition is innate in the person or that it is an absolute part of that person without first doing your homework. What is your homework? Your homework is to look at all the extrinsic factors. Is this person taking any meds? Now, it doesn't mean that you can't use meds. Someone can't take meds and also take homeopathy. They certainly can. But my point is, you will be surprised. I guarantee it. And if you're here next week and you've done the research that I'm suggesting that you do now, please come back and report to me and all of us next week. I guarantee you will see this more often than you ever expected. It will be astounding to you how often the condition the person is suffering from is simply a side effect of the drugs they've been taking. Now, don't tell me, oh, but he's been taking these drugs for 10 years and this condition is only 2 years old. Well, how long does it take for the body to say, I give up, I can't handle it anymore? This drug is so bad for me or is so heavy on me that I am giving up on some level. Not death, I'm not talking about that, but I'm giving up. And so sometimes it takes a while for a drug to cause trouble. Now, I am not one to say get everybody off all their drugs. What I am saying is that don't start them in the first place. But once you're there, now you have to be judicious. And you can't just hop off of drugs without knowing what you're doing. And since I'm not a medical doctor, when I work with my clients, I don't tell them to stop their drugs. Instead, I use the homeopathic medicines. I teach them how to use them themselves. And then they start improving, and then the need for the drug is gone. The drug becomes superfluous. It becomes unnecessary. In fact, it becomes belaboring. And so if you don't look up the name of the drug and the side effects, because you will be there, your eyes will cross because you will be there for so long reading all the side effects. Instead, there are a couple ways you can do this. You can go online and look at, does my blood pressure drug, does metoprolol cause weakness? Does metoprolol cause a feeble heart? Does synthroid cause thus and so? Get the name of your the name of the medication that you're taking for bioidentical hormones, which are nothing more than just synthetic. I hope you don't believe that those are really identical. They're not identical, because if they were identical, they would be from another woman or from a mare, at least. Those are synthetic drugs. Does this bioidentical hormone cause weight gain? Does this bioidentical hormone cause trepidation or whatever the person is suffering from? Once you have done that, that's one of the preliminary aspects of taking the case. So we don't just hop on and say, well, it must be that this medicine is for that drug. This medicine is for that condition. If a drug is causing it, then you need to reconsider the drug, or you need to start treating the condition that the drug is supposed to be addressing of sorts. So, and that will then take care of potentially the problem that you're about to treat with homeopathy. So you have to do a little backstepping. You have to go do your homework. You want to go through every one of them, and don't forget vitamins. I'm afraid I am not a vitamin supporter. I believe vitamins are synthetic. Not I believe they are. Vitamins are synthetic unless they're naturally occurring in foods. So if you want vitamin C, you eat oranges, bell peppers, grapefruits, lemons. If you want even more and you want to take it on a day-to-day basis without actually eating it per se, then you get rose hips or acerola. So you're going to be getting something that is actually the food. So instead of taking vitamins, you are eating vitamins. That's the way I want you to think, because vitamins can cause trouble. So can supplements. So I want you to know that those kinds of things can cause symptoms that would lead you to believe that this person has a cardiac condition. And one of the cardiac conditions that we see pretty consistently is a reaction to eating foods that are high stimulants, such as too much coffee, chocolate, alcohol, especially red wine. Not always, but red wine is another one. Tea, even kombucha for some people. And I think kombucha is a great drink, but even that can cause trouble for some because it has the caffeine from the tea in it. All right. Let's see if we've got some more questions on Facebook. Can we use it for veins cause? Oh, it's moving along. I'm sorry. Best choice for congestive? No. Congestive heart. This is not it. I'm sorry. What's happening is there's so many questions coming in that just when I'm about to read it, it flips and goes to the next and becomes unavailable for me to read this. Fatigue and muscles. Could this be used for stenosed veins, stenosis of the veins, I think is what she's saying, that causes symptoms such as fatigue, and no drugs have been used for symptoms. Here's the thing. Could this be used for stenosis of the veins that causes symptoms such as fatigue and muscles? This is important for you. I want you to think about this. I'm not saying that this can't come from the veins and the person now has tight muscles and fatigue. But what if it's not from that and it's just theoretical? Now you've wasted time. So instead, the way I like to look at this is if you can say, what's the condition the person's experiencing? Fatigue and tight muscles. Why not just use the medicine, homeopathic medicine, for fatigue and tight muscles? That's more specific. You're hitting it right on the nose instead of wondering if it could be from the veins. Now, it could be from the veins, but I wouldn't start there. I start with what's obvious, not what is based on theory. So I hope you know what I'm saying here, and I'm going to reiterate this through the weeks as well. What about someone that has had triple bypass? Well, we don't give it to someone who's had triple bypass because they've had it. We give it to someone who has these symptoms. That's the way we look at it. Husband has pacemaker when he has problems with just walking across the yard. Yes, that could very well be. When someone can barely walk across the yard and they have, I'm assuming, breathlessness or heart pain, then by all means, this could be a medicine that could be considered. So this is something that I will definitely be investigating. Good. You've sparked an interest in researching the issues with electricity use when not feeling well. Yeah, you bet. Hot water, Bella. There's nothing like them. Let's see. You've got the potency there. All righty. Now let's go back to some mighty questions. Haven't taken drugs for years. Suspecting teeth. Suspect teeth. Suspect teeth. I'm going to have to go in a second, but if anyone has had a tooth that was extracted, suspect that there could be a bone infection. And so I'm going to dash off with that because I've got a group meeting now. And for those of you who've never joined any of my Gateway to Homeopathy groups, you might want to consider it. That's what I do every Monday night after these meetings. So with that, everyone, I say God bless all of you. Mwah! Have a great week. And let's see what happens tomorrow. It's pretty exciting. Bye now.